So this is a busy crom case, and in these cases, I always focus on the intracranial findings first before going and getting bogged down on describing the fractures. Main finding here, obviously, is this lentiform shaped extra-axial right frontal convexity hematoma. This lentiform shape, obviously, being very characteristic for an epidural hematoma. Within this hematoma, you can see these areas that are hypodense, and these actually represent areas of active bleeding where the blood hasn't had a chance to coagulate yet. So this is probably a rapidly expanding hematoma. Obviously, it's exerting a lot of mass effect upon the adjacent right frontal lobe cortex. There's a midline shift. You can go to like the level of septum pellucidum. It's quite a bit displaced past the midline. There's effacement of the frontal horns, obviously right side, but to a lesser extent also on the left. You can see the right lateral ventricle, even the trigone is also very much effaced. Pretty much all of the right lateral ventricle is effaced. Now, one thing with the epidural hematomas is that they're not supposed to be crossing sutures, but if you look at this thing on bone windows, you'll see that it's actually crossing that coronal sutures. The reason it happened to do that here is this right parietal bone fracture right here. As you trace that right parietal bone fracture, you can see that it extends to the right coronal suture, and there's diastasis of that suture. So that suture is pretty much disrupted as a result of that fracture. And so those tight dural adhesions that would typically prevent an epidural hematoma from crossing a suture are probably disrupted, and that's what resulted in this epidural hematoma crossing the suture. This was a surgically confirmed epidural, so it's not some mimic or anything like that. Now, looking at the rest of the brain, we see some additional areas of hemorrhage. So these could be the axonal shear pattern injury. There's an intracranial pressure monitoring device here, right here. This guy that's you can see going through the hematoma actually, and then goes through the soft tissues, and then comes out of the skin. In the soft tissue portions of it, obviously some more hematoma. This was placed at an outside where an initial head CT supposedly didn't show this epidural hematoma, so this obviously was a very rapidly developing epidural hematoma. Going further inferiorly, we can see some additional intraparenchymal hematoma in the right inferior frontal lobe, going to the adjacent subinsular region, and some vasogenic edema associated with that. Now that we've discussed these, we go ahead and talk about the actual fractures. So we saw this right parietal bone fracture. Obviously, we already discussed that it goes to the right coronal suture, and as it goes inferiorly, it sort of extends to the right sphenoid bone, the lesser wing of the sphenoid, possibly a little bit into the greater wing of the sphenoid as well as the right lateral orbital wall. Now, anytime you have a fracture involving the orbital wall or the orbit in general, you want to look at the soft tissues and see if there's a lot of hematoma within the orbits. And you can see here, right next to that fracture, there's a small amount of hematoma. It's in the extra-conal space, so outside that space bounded by the extraocular muscles. It does exert some mass effect with this curved morphology of the lateral rectus muscle, but the region of the orbital apex, which is where the optic nerve goes to the optic canal, like this particular region, you can see there's still some fat preserved, so it's probably not immediately dangerous, this hematoma, just something to keep an eye out. Now, once you look at the orbits, obviously paranasal sinuses is something to always look at. Whenever you see this blood fluid level in the paranasal sinuses, you can see these hyperdense material layering, and that's the setting is trauma. You more or less know that there's going to be fractures, or you got to have a very high index of suspicion for fractures. The fractures of these, because the walls are thin, are better seen on these dedicated bone recons, and you can see here, right there's a fracture of the posterior lateral wall of the left sphenoid septum. Sphenoid wall, sorry, and then also another fracture of the sphenoid septum right there, accounting for the blood you can see on both sphenoid sinuses. And those are the main findings in this case. The rest of the case was pretty okay.